Hi, I'm George Russell, and this is not a grand piano. And that also means that I won't be singing show tunes today. I know some of you will be bitterly disappointed. But what I will show you is how to differentiate between different causes of groin pain if you have it. So we'll start with figuring out if it's, probably joint restriction or immobility or something like that. So for that, you'll take your leg up and interlace your fingers on the far side. Then you're going to take your knee on a diagonal. It's not like this, and it's not like this. It's in between over here. And then I can move my leg around a little bit in this position. If I feel a stretch on the butt, then that's probably a normal hip. But if I feel the groin pain on the inside here, then it's probably hip joint fixation. There's a couple of ways you could work with that at home, but I would have to show you. And really, probably this kind of a problem means that you should come in and get a treatment from me. But now let's look to the muscles which you have a little more control over. There's one muscle called the psoas. It's the main hip flexor. It does that. And that can cause groin pain. It's pretty common. So you can start like this, and then slowly slide your heel up. This is pretty slow, right? And then I'm going to lightly take my knee over my belly, keeping this part relaxed. If that creates the pain you've been having, then it might very well be the psoas causing it. Now on to the inner thigh muscles, which are called the adductors. I'm going to take my feet and my knees together here, and I'm going to slowly separate them and take them down to or towards the ground. Then I'm going to slowly bring them up. I'm going to go so slowly that the movement isn't smooth. Can you see that? It's a little ratchety. As I do that, if I feel the pain in my groin, then it might very well be the adductors causing the problem. Now let's move on to the superficial hip flexors, which are located around here and also here. To stretch them, you'll come on your side, and you want to be absolutely straight with none of your body parts front or back. Those of you who have experienced the delight of an ant farm will know what I mean. You don't want anything forward or back. You want to stay between the two panes of glass. And if you haven't experienced an ant farm, really, go out and Google it, okay? So take my word for it, I'm a doctor. So here I am on my side. I'm going to take my foot in my hand, keeping my knee next to the other knee. Could you take the camera around? And I'm going to bring my foot back like this, keeping my shoulder blade near my spine to protect my shoulder. And if I feel the pain around here, then it might very well be these muscles that you're dealing with. Now, some of you won't be able to reach your foot. I have freakishly long quads. So you're going to want to take a towel. I think you want to. Maybe you want to. If you want to, you can use a towel. I'm going to keep that around my foot and pull back with that, keeping my shoulder blade near my spine, keeping my knee next to the other knee. So that's a good way you can find out if it's caused by muscles here or muscles here. That's about it. Let me know if you have any questions.